Hi, I'd like to welcome you to the University of Iowa Stead Family Children's Hospital and our wonderful fellowship in pediatric anesthesia. My name is Dr. Tom Long. I'm the Division Chief for Pediatric Anesthesia.
And I'm Dr. Mueller, one of the Pediatric Anesthesia faculty and Program Director for Pediatric Anesthesia at the wonderful University of Iowa. And there's our hospital.
We are going to take you on a guided tour of this wonderful facility, which is the pride of Iowa. Thanks for watching. We lovingly call this the fishbowl. This is where the operations for the OR actually, the management actually takes place. This board depicts all of the day's cases, and the various colors indicate whether the patient is, the case is already completed, or whether it's soon to be started, or if it's actually underway. So this gives us the visual display of what's going on in the OR. One of the other great features we have here is we have an OR pharmacy right on site. And so you can get your drug medications and return them here for all of your cases. The pharmacy staff is fantastic. This is what we call phase 1 recovery. We have 12 recovery rooms here. They are individual rooms. Okay? Each patient has their own room. They're fully monitored. And if you'll come in a little bit closer, I'll show you one of the other wonderful attributes we have. And this is true for the pre-op rooms as well. The children can watch movies while they're waiting or waking up. And we can actually transport those movies, the same movie, over into the monitors in the operating room. So as they go to sleep, they can continue to watch their movie.
And speaking of monitors, the whole Children's Hospital has a universal Philips monitoring system, meaning that each patient can keep their monitoring lines on them, and we can dispatch this monitor, and it travels with the patient from the pre-op area into the OR to the PICU. So with that, you avoid unnecessary delay and even periods without any monitoring. Inside the elevator has all equipment, suction, defibrillator, and onboard oxygen available to resuscitate if the patient should become unstable during the transport. The procedural sedation area where we conduct for any kind of invasive and non-invasive smaller procedures, general anesthesia and sedation services in a one central localized station though. And this one is our induction area where we have 3 separate induction rooms for each patient that will either go to CT scan or into the MRI. And I think one of the big advantages here is that the monitoring that we are putting on the patient is MRI compatible and does sleep into electronic medical record. Now down here is actually the core and the heart of our sedation area down in lower level 2, where we have 6 state-of-the-art operating rooms. We can have a look and see one example what it looks like.
This is the anesthesia workroom just for the children's operating rooms, and it's fully stacked with all the equipment that you could need. Why don't you walk with me and I'll show you what we have. We have multiple fiber optic scopes and airway equipment as well. This is the CMAC system. There's usually about 8 of these here. We have ultrasound for vascular access and also for peripheral nerve blocks. And pretty much every bit of equipment that you could possibly need, all of it, of course, oriented to children, is all here. This is the movie theater for the children. It's also interactive with like Wii and those sort of games that children can play. We have several workstations in the PACU and the pre-op area, and this is one of them. And as you see, we can watch the football games on Saturdays.
Go Hawks!